Hi, my name is Davis Cantwell. I'm a physical therapist with F.I.T Muscle and Joint Clinic. We're here at Olathe at home field. Our clinic's just over there, and we've got access to this beautiful turf out here at home field. We're going to go through injuries that are common with long distance runners. The first one we'll talk about is Achilles tendinitis or plantar fasciitis. Both injuries kind of treated similar. So first of all, most of the time these are just overuse injuries from repetitive loading of that calf. The first thing we'll do for an exercise is we're going to eccentrically load that calf. So I'll have Nate come over here. He'll step up onto that box and he'll take 1 foot and go up and 1 foot on the way down. Now up and back down. So ways to help with these two conditions: stretch the calf and eccentrically load the calf, just like we're doing here with this exercise. We want the heels to make sure they're coming off the edge of the surface, okay? And whenever we bring both heels up, go ahead and bring both heels up. We want to go ahead and shift the weight just to that 1 foot before we work our way down. Really, the main part of this exercise is the way down. We want to really load that, that calf as long as possible. The next condition we're going to talk about is Patella femoral syndrome. That's pain just on the anterior part of the knee. Typically that's from overly rotating at the hips, and so a lot of times hip stability is a problem. So the next exercise we're going to do is tall kneeling stance. So hip stability as well as quads. So we're going to activate the quads here with this exercise. So go ahead, Nate. He's going to come up and down from that stance. And continually load that quad. Here in tall kneeling stance, one of the things we want to look for is we want to make sure we're going up and down, almost like a vertical movement. We're not lurching forward or to the side, going almost just up and down. 80% of the weight should be through that front leg, okay? Really loading that quad up and down. Again, nice and slow, trying to be as controlled as possible here. Minimal contact through the hands, mainly just for balance. One of the next most common conditions is shin splints. So the exercise we're going to do with that is called hanging stance. So Nate's going to come over here. Really what we're wanting here is good loading of the foot. A lot of times with shin splints, we're not getting that good loading of the foot. So we're making sure that our foot's completely in contact with the ground, okay? And we're in this position, this stance. Here in hanging stance, we want to make sure that knee stays over that ankle joint. We don't want that knee too far forward over our foot or too far back either, right over the ankle joint itself. And what I'm going to do here is I'm going to provide this force to the outside of the knee, just like this. So you're going to picture like I'm pushing you inwards, and as if there's an invisible barrier here. We're loading this foot in the triplanar stance. There's 3 points of contact on the foot, and really loading it in. The next condition that's most common with long distance runners is IT band syndrome. So with IT band syndrome, a lot of times it's weakness of the hips or that femur rotating internally too much. So one of the things we like to do is work on that hip stability, and this is called 5-month sideline. So Nate's going to go ahead and come up and down from kind of this side plank position, really loading that hip. A couple things to keep in mind when doing this 5-month sideline is we want to go nice and slow throughout this motion. Slow hip stability. We want to be loading through the lateral quad in the knee, not as much the other places that are in contact here. He's doing a great job of keeping his spine really neutral and just keeping that body going over and back. Any of these exercises that we showed would be great to include in any kind of warm-up you do. Anything that can get your blood going, sweating, or even just get those muscles activated. I recommend getting a sweat before you do any kind of static stretching, so make sure you kind of get warmed up first.